Well, hello, and thank you for tuning in to Canceling COVID. We are working together to save our families, our communities, and our way of life. Thank you again for taking time out to join us. I'm Tanya Rivens, and just great to be with you on this Wednesday. We're also grateful for our sponsors, Groundwater Solutions, as well as Mecklenburg County Public Health. They're working really hard to answer your questions. So, any questions you may have or any information, reach out to Mecklenburg County Health. They've got all the COVID information for you, including vaccination information, mecnc.gov or 980-314-9400. Let's get straight to our question of the day. What health changes have you made because of COVID-19? You know, there's so much conversation about how COVID-19 has impacted communities of color, that is. And I'm just wondering if you're more alert about your health now, or, for those that was not checking on, say, going in for a mammogram, or making sure that you're tracking your cholesterol, or making sure as far as your heart, just all of your health, your blood pressure, those items that are so important for us to survive. Have you made some adjustments, even your eating habits? Yeah, we got to talk about that too. So, overall health, have you made any changes to your lifestyle because of COVID-19? Because it drastically exposed so much. This virus has killed a large number of African Americans because of underlying health problems, obesity. I mentioned that, high blood pressure, are just a couple of those. So, what are you doing about your overall health? I really want to have this conversation because I think for so many of us, it's now a way of life that we have to adapt and just make changes. I always say my weakness is sugar, and I try really hard. I'm probably down to maybe one sweet cupcake, candy, ice cream, whatever a day. I've been killing it. I got to tell you, just awful, but I can't help it. It's in my blood. So I've got to do better though, because certainly we know there are a lot of risks involved. So I want you to tell me, what adjustments are you making? But right now, I'd like to welcome my first guest, and she's really more like the co-host of the show, to be honest with you. I don't even call her a guest anymore. Dr. Tracia Black from Groundwater Solutions. She is a big part of this movement, this conversation. And Dr. Black, first of all, good afternoon. I'm always excited to see
Hi
you. It seems like
there.
a whole week is way too long, but
I know,
great to
right?
see you.
I look
Yeah, and you're
forward to these times that we can talk together.
well, the feeling is mutual, and obviously, people hopping on feel the same way. We're going to keep this going because this conversation is something that's not going to go anywhere. Even as we
Mm-mm.
see numbers drop, we see things kind of returning to the new norm, but there's still going to be the issues, and we'll talk about that later, about some of the issues that we still will have to address. And so, talk a little bit about why COVID is so dangerous and so deadly for people of color.
I think you hit the nail on the head, Tanya, when you talk about the underlying health conditions. We have a lot of them. And the major issue is not necessarily that we have them, it's that we don't take proper care to manage them. We don't go to the doctors regularly. We have problems, health problems that we don't address. Some of the research says that we are five times, it takes us five times longer to go to a doctor to see about a health problem than it does other populations. So, you may have that pain in your side or something happening in your leg, and we just ignore it. And, I don't know whether we ignore it because we're afraid, which I think is sometimes the case, or that we, you know, just have to work and we can't stop to take care of ourselves. We have so many different issues. When we first started out with the pandemic, one of the conversations that I was having repeatedly with the state and with healthcare providers is that African Americans have 99 problems, and COVID is not one of them. It's not at the top priority when
Right.
we have so many other um, financial needs, resource needs, and health needs that COVID was just not a priority.
And you make a good point, and whether it's because of health insurance or work,
Hmm.
or just that what we've been taught is just to press through it, and it's a
Hmm.
cultural thing. I had shout out to Reverend Kennedy of Union Bethel AME Zion. He and I had a conversation because one of the neighborhood kids passed away from diabetes, and I go, "How is that possible? How do you find out 2 months ago?" And then you transition, and he said, Tanya, it's a culture in our community. These conversations about health, addressing these issues. Clearly the young man was struggling with it. And I was saying, why didn't somebody just, connect him with a caseworker? And
Hmm.
so we've got to have more of these conversations and
Right.
start. addressing them. But have you been surprised about how the virus has affected Black and brown people at all?
I have been not necessarily surprised, but more alarmed.
Okay.
What I have seen is that even dormant issues, someone who was actively managing, maybe they had a diagnosis of diabetes and they were actively managing it. They had gone from insulin to just metformin,
Mm-hmm.
oral medications. COVID woke up their diabetes, I found that it woke up cancer and tumors. It woke up illnesses that were dormant or even sometimes well managed. It exacerbated those illnesses. For folks who didn't know they had certain illnesses, they are finding out after being infected with COVID or after taking the vaccine that these issues are reawakened, or they are becoming aware of new issues that they never knew that they had. So it's something about the COVID virus as well as the vaccine that will wake things up in your body. So really the important thing for us is that we start taking care of those health issues,
And
whether so that we're protected from both the virus and any effects of the vaccine. We've got to address those things. We've got to find healthy ways to eat. And again, we could just say, let's focus on health care, but a lot of our communities don't have access to health care. They don't have access to grocery stores. We have food deserts
right.
out there. And so there are lots of things that have to change for us to become healthier. But the first thing is for us as a community to say, this is important. This matters. Our lives matter. Our health matters. And we want better for ourselves.
Well, you said the alarm. So, do you think this whole COVID pandemic is a health wake up call then for the community? What the doctor ordered, so to speak?
I think it is. I think it is a wake up call for us to see how important it is. It's a wake up call for other communities outside of us, our legislators and other people, to know that resources are needed for the health care of brown and Black people, that we've got to pump in funding for the things that we know that we need. And I think we also have to allow brown and Black people to be part of the discussions as how those funds are going to be used. Because sometimes we have lawmakers and funders who say, okay, well, we're going to give $1 million or $10 million, and they decide how it's going to be used. Right. And it kind of trickles down to us, and we think that wasn't really a good idea. It should have gone this way, but we're not part of the initial discussions. And so my hope is that it's a wake-up call for us to be a part of the conversation, to want to be, and for the doors to be open for us to be a part of those first conversations, those funding decisions.
More of us at the boardroom table when you're making these decisions. And I thought we were starting to turn the curve on that with diversity and all of this. But it seems like it just always creeps back in the room where we are not represented, and that is not indicative of the community that you serve. So when it comes to taking better care of your health, where would you say people should start?
Make sure you have a primary care physician, a primary health care provider. The state is also going through changes with regard to Medicaid. There's Medicaid reform where in July 1st, there's going to be a whole new healthcare system in North Carolina. Wow. There are 5 new companies that are coming in to help manage state dollars and Medicaid dollars. So every person who is on Medicaid has to select one of those 5 providers, or they're going to select one for you. They're also going to assign you a primary care physician. So it's time now, time is of the essence, that each of us pick a primary health care provider. If you have a private insurance or public health insurance like Medicaid or Medicare, you have to do that now. But there are also resources if you are uninsured. Each county has some dollars available to provide you health care. Here in Mecklenburg County, there are Care One is a place where uninsured can receive services. Myers Park Medical System also has resources for folks who are uninsured. So even if you don't have it, that it should not be excuse for you not to go out and find health care. Get you a primary care physician, have a full medical physical, have everything checked. Tell them you want have everything. Don't be afraid to, let them take blood, run some tests, get your lab work done, and then pay attention to the results and do something about it. Develop a plan to start improving our healthcare. I think that's issue number one.
So, Dr. Black, healthcare.gov is still an option too, isn't it?
It is,
Okay.
for affordable health insurance coverage.
Okay, so let's talk about how patients can make sure doctors are taking the time to help them. And that whole bedside manner, and not just rushing them from appointment to appointment between patients. And find this is a problem with doctors, especially when it comes to appointments and not contacting patients when there are some serious issues going on. And I really want to just speak to that again, because as somebody that used to work for the airlines, and how I would get my behind handed to me because we were running late. And these are the same people, when you go to a doctor's appointment, sometimes they'll make you sit out there for 30 minutes to 40 minutes because they're running behind. And then when you come in, because they're trying to catch up, they're not giving you that undivided attention. So kind of speak to that a little bit. What can patients do to make sure that they're just not being rushed through? Not to mention culturally, there are some issues that we deal with that some people that don't look like us really don't understand.
Absolutely. I think the first thing to do is to do your research. So make sure you choose a healthcare provider that is going to care about your needs and your issues. Interview them. I remember times in my life where I've needed a healthcare provider for my children or another family member or myself, and I Google and I research the healthcare providers. I make appointments for consultation and I interview them to make sure that this is a good fit for myself or whatever that individual's needs are. So it is okay for you to go and interview a healthcare provider before you make a decision. After that, once you're ready to make visits, then go ahead and jot down what are the things you want to know when you get there. What are your questions going in? Most people, when they go to a healthcare provider, especially if there's a problem, they want to know what's wrong with me, how do I fix it? And how long is it going to take, or what is it going to take to do that? So go in with those questions in mind and tell the doctor, I need you to take some time with me to answer these questions, and bring out your list. And, I go in if something's wrong with me, I'm already researching what the symptoms are. I know what the possible causes might be. And when I go to my healthcare provider, I'm listening for those things. And I ask questions and I say, no, but I read A, B, and C. So they have to take that time to address me. And I think the more knowledgeable we are, the better healthcare we're going to get.
And to that point, the more elderly and seasoned brothers and sisters, kings and queens that we have in our community, young folk, children, help them. Go with them.
Go with them.
Mom, yes. And ask questions for them. Be that voice to say, hey, wait a minute, this is not, I'm not feeling comfortable with this. And, observe and just be there, even if they don't want you to go, because my mom will go by herself in a minute. But,
exactly. My mom is the same way.
Yeah.
And she's very strong-willed, but when she has a healthcare issue, I am going with her. If I can't go, even during COVID-19, only one person could go into the doctor's office. So you could not accompany a patient. So I would say, you guys have to call me while you're in there with the doctor. And so I'd be right there on the speakerphone and I'm listening, and I still do that. So we have to be advocates for our seniors. If you have a senior in your family or community, offer your support for them. They may not know how to ask or what to ask, but you offer. Don't wait to be asked.
And that's what happens a lot. They're not exactly sure what to ask. So, Dr. Tracia Black, I see you all hopping on. Please comment on a question of the day. I know you're making some adjustments for your lifestyle concerning your health, because we've all had to make adjustments. If it's nothing but going out to restaurants, it changed. We went from sit down to carry out to reduce menus. And of course, in the grocery store, we had to make adjustments with some items not being available. We've got the food deserts around town. Some people started growing their own, which is certainly a great idea. Trying to eat healthier is what I'm getting at, or trying to be just more mindful of what you're taking into your body. So Dr. Black, Groundwater Solutions, that's groundwater-solutions.org, 704-596-0505. Where are you guys testing today? You're always out.
We're out at University Adult Care, and we are testing at and providing vaccination at our local office at 5104 Reagan Drive, Suite 5.
And that's just off Sugar Creek. It's easy access to hop off and then get back on and be on your way. So I certainly appreciate that. Any final thoughts, Dr. Black, until we get to speak again?
No, just it's a call to action for the community. Let's take care of us. Let's take care of each other.
Oh gosh, I love you saying that. I just know we just have to keep saying it over and
Hmm.
over and over because when I got into this, what went off in my head is no one's going to help us but us. And we got
But
to get
us.
started and
Hmm.
address these issues. So thank you again. Always
Thank you.
appreciative. And give out your phone number, website one more time. Well, she cut you off. It's groundwater-solutions.org. Again, groundwater-solutions.org, 704-596-0505. Thank you, Amelia. Sometimes it's hard to follow me, but I'm so grateful that she is patient and she continues. So I need your comments. Come on, folks. Question of the day. What type of adjustments have you made to your lifestyle as far as your health, your overall health lifestyle because of COVID? What exactly are you doing? I see a lot of you can still hop on and make comments after we're off air, but I love sharing those comments with others. So I know it's hot outside. I know you're somewhere cool, tuned in. We're heading down towards the holiday weekend. But we still got to talk. We got to have these conversations to keep everybody in the know and to realize that we are still focusing on canceling COVID. Now, to an issue impacting all of our children here in this country. I'm talking about their education. COVID 19 created this issue for so many students, what's being called the lost year. And it has been. Listen to this. The average student could begin the next school year having lost at as much as a third of the expected progress from the previous year in reading and half of the expected progress in math. Now, those are some pretty heavy numbers. And, talking about dumbing down, we're doing a disservice to our children, is what's really happening here. I mean, those numbers are so impactful. You keep that in mind. And we have to be concerned because these are children, they are our future. And we should be actively engaged in trying to figure out a way to help them make up for the time that was lost. I know CMS is doing a summer camp where kids are going to be attending, but I've said all along, why don't you just have everyone that wants to reclassify and do one more year? I think a lot of parents would be okay with that. And it's okay now. When I was coming through, if you had to repeat a grade, it was kind of like a stain, embarrassing, all kinds of other stuff. But I mean, let's be realistic. These guys are missing out on some critical needs right now. And so we need to have the conversation. But we do have someone here that's joining us, Latonya Blackman. She is of the Scholar Learning Center, and she's got a plan to help address this issue. So I'm honored to bring her in and to talk about this. So first of all, Latanya's the CEO of Scholar Learning Center here in Charlotte. Good afternoon, and thank you for hopping on with us.
Good afternoon. Thank you for having me. I appreciate being here.
Absolutely, it's great to meet you as well. Yeah, so from tutoring, test prep to summer camp, you and your tutors, y'all are focused on giving children a quality education. Have you noticed that the impact of COVID-19 on our children academically?
Yes, absolutely. Our children, Black and Brown children, are at a greater disadvantage than some of our counterpart. Um, that minority population, for some reason, they are more academically behind, even more during the pandemic than they were prior to the pandemic. With virtual learning, there's a lot of students who are either confused when they are online in their classroom, or they're just not signing in at all, which is causing a greater loss for our students.
And it's really so unfortunate because it's no
Yeah.
fault of theirs, and we never know what the home situation is. And we had the digital divide, and I know the pandemic pods were set up in some of the communities more fluid that helped the students work through a lot of things. And for a lot of our minority children, they didn't have that option because the parents out working when they could. A lot are essential workers and just doing what they can to just survive and keep the household going. So what concerns you the most when you hear those numbers and see what you're dealing with?
Well, what concerns me the most is that parents are relying on report cards to tell them how much their children know. where actually report cards tell you how well they're doing in the classroom, but it doesn't really let you know how much your children know. So it's not until they take the standardized test that parents are realizing that their children really need help and that they're really behind. So I would like for parents to not depend solely on a report card. It is a good indication. However, it is not the most accurate information as to how well your student is mastering the skills that they need.
And that's a good point. And especially for those that are able to just memorize for the sake of taking a test or memorize for the sake of getting through. I was pretty good at that myself and not really absorbing or comprehending the information. That's a great point. So, parents, please listen up. Several studies show the amount of learning loss is even worse for minority children. You kind of already pointed to that reason. Um, you obviously agree with that statement, but why, if you could add any other factors on why you agree with it?
Well, a lot of minority students were already behind even before the pandemic. In the city of Charlotte, where I'm located, we have a ton of Title I schools within the Charlotte community. I believe the number is about 42 schools that are lacking behind. And that is a large number. That is a lot of students. And because those students were already behind and not receiving the quality education that they needed, or the parents just aren't aware as to what their children really need academically, with the pandemic, where we were shut down for a few months and then they went online, our school district is just trying to figure it out themselves. So when we have a school district that's just trying to figure it out themselves, and of course our parents, they don't have a clue because they're not in the district. The children don't know. And then they go online and they try to learn, where you have a teacher and you have 25, 30 students online, and students are either not showing up for class, or they're afraid to ask questions. It's very intimidating to try to learn online for children. Think about a first grader who has to sit on the computer for hours and hours of the day and try to learn math. So this is just causing a great disadvantage to minority students, because our students are already behind the curve. We started behind. So the
Yeah.
gap is just wide.
And of course, we can't ignore the fact that there's that debate going back and forth right now publicly, where some black ministers and other leaders went to the county and said, "Look, you hold up that funding to Charlotte Mecklenburg schools until they give us a plan that's going to help our
Yeah.
students." The disparities are ridiculously high. Excuse me, it's
Yes.
been going on for too long, and we demand that something is done before you release that funding. And I received a note today. The Charlotte Mecklenburg Black Political Caucus is hosting a press conference today to say they too agree with that and they want to see what happens. So, where did the idea for Scholar Learning Center come from for you to get started?
Well, I've worked with children for over 20 years in various ways,
Mm.
starting in ministry. And then about 9 years ago, I opened a child development center. And our priority focus was academics and enrichment. So once the pandemic hit, I pivoted my business model to focus on tutoring and personalized learning.
Mm.
So now we're mainly focusing on personalized learning, which is individual to the student.
That's good, and thank you. Hats off to Lifetime Educators. My sister is one, and you all are definitely a jewel cut from a different mold. I often get on her about being so structured all the time, and I couldn't be more the opposite. So I appreciate your gift of serving our kids. So, how does Scholar
Thank you.
Learning Center though help bridge the academic gaps for our children? What is involved with that?
So, first thing we do is we begin with having our students to complete an academic assessment. With
Mhm.
that assessment, we're able to determine what skills they're mastering and what skills they are weaker in reading and in math. Then we develop a plan for intervention. that will not only allow the student to master new skills, but also allowing them to continue to learn past their grade level.
Mm.
So, with that plan, students receive one on one instruction. We also help them with, we give them resources and different tools where they can take home and practice mastering skills. So, learning doesn't only happen during our sessions, but
Right.
we give them the resources that they need so that they can continue to learn at home as well. But we do that through tutoring, one on one sessions, small group sessions. We also do that during our summer for our academic learning camps. And then we also offer test prep. We offer math, reading, science, homework help, um, pretty much whatever the student needs at that moment. So, with that, we're able to bridge the gap between what they're learning in the classroom and what they're missing. So, we're not only um, helping them to learn what they need for that grade level, but we're helping them to continue to learn and supplement their learning on top of what they're learning in school so that they can at some point learn past their current grade level.
Wow, that's great, great work that you're doing. So, to kind of talk about your summer programs, what specific programs are you offering, and how can parents register their children?
So, our summer programs, we currently have reading, English language arts, reading camp. And our camps are weekly camps. We have math camps. We have our creative writing camp. We also have STEM and STEAM camps, which include entrepreneurship as a way of helping students to be more inspired and learn the in and outs of launching their own business. And then our camps are for grades 1 through 8. And we are offering camps online as well as in person here in the Charlotte area.
Wow, it's great to hear the STEM piece and entrepreneurship. We've got to get into that so much more in our community. Do you have any tips for parents as they work with their children at home over the summer break?
I do. I do. I would recommend that parents not wait until their children are struggling to enroll them into tutoring programs. I also recommend that parents make sure that they put their children in some summer academic programs. You know, whether it is Camp CMS, which is a free program offered through our school district here in Charlotte. I recommend that all parents enroll their students. If you've missed the deadline, you definitely want to put them in some sort of academic camps. If it's not with us, with someone. It's just so important. We need to be able to, bridge this gap, bring these students to where they need to be as quickly as possible because they only have about 10 weeks before they go back to school. So I want parents to start thinking differently about tutoring as well. I want parents to think of tutoring as a supplement to what the children are already learning in school instead of a cry for help when they are already having a difficult time academically.
Oh, that's such a great point that you make there. And forgive me for grabbing water. I was trying to avoid coughing. So, Scholar Learning Center, Miss Latonya Blackman, scholarlearningcenter.com, sharing some great nuggets and families, parents, relatives, anyone that has any contact with our young people, we shouldn't see them not involved in academics this summer because they got a lot of work to do. It doesn't have to be the entire day, but get them into some of these camps that is working on academics. Maybe a nice mixture is good. So I appreciate the points that you're making. Anything else that you would like to share, Miss Blackman, before I let you go?
Yes, actually, one final thought. I want parents to understand that education is an investment. It is probably the most important investment you'll make in your life for your children. So, as parents, either we pay for it early or we pay for it later. So, please invest into your child's future early.
Thank you so much. That's Latanya Blackman of Scholar Learning Center. Give out your phone number and website before we let you go.
Yes, we can be reached at 704-200-9021, and our website is scholarlearningcenter.com.
Good, good stuff. Thank you again for taking the time to talk with us. Now, I want to get to a few headlines right now before we wrap things up. A little more than 48% of adults in North Carolina have been vaccinated. Well, we're almost at the 50% mark. That's pretty impressive. Now, 25 new cases were reported in the state on Tuesday. But how much testing is going on, folks? How much testing is going on? Nearly 700 people are being treated for the virus in North Carolina hospitals. But most importantly, the numbers are trending. They're looking so good right now that we are headed towards turning the corner to get back to our new norm. And it's so nice. I made this comment last week. It's like revenge travel, revenge events. I mean, the whole social thing is kicked off where people are having so many events happening, but pace yourself and make sure you continue to, of course, wash your hands, do the personal hygiene, wear your mask where you're required, and maintain the physical distancing as well. Well, it's time for me to go. A great conversation. I always love it when we can talk and give you great information. Not a lot of feedback in the chat today. That's okay. There will be days like that. You can go ahead and hop on and make your comments even after we're off the air. Amelia goes back and looks at the comments, and it helps us also to prepare for any future topics. So as always, life's challenges make you better, not bitter. I appreciate Mecklenburg County Public Health again for supporting this meccounty.nc or mecgov.nc, that is. If you need to reach out for additional information about vaccinations or any information, they're certainly there for you, providing that info. And thank you, Mecklenburg County Public Health, for being there for us and taking that additional step to make sure that you're getting the word out. There's even some incentives now. If you haven't gotten your vaccination, some places you can get some cash, gift cards, some money. So 980-314-9400 if you have any questions. Have a great day, everyone. Be safe. Thanks for tuning in. Together, we will continue to work on canceling COVID.